how to give an emergency injection for those with adrenal insufficiency who are going into adrenal crisis. This is a life-saving protocol that I like to reshare every year because it is essential and it can save someone's life. So everybody with adrenal insufficiency or an adrenal disease that requires an emergency injection kit should be carrying one. Inside there'll be a range of different type of devices or medication, but this is what's in mine and the essential things needed. So first we have active vials, which is the medication, the emergency medicine. Sometimes they come in a liquid and a powder form separately. This is not an ideal form of emergency medicine, but unfortunately sometimes that's all that people have access to. But the active vial, which is liquid on top, powder on bottom, is the fastest method of administering this medication during an adrenal crisis. So I need an active vial. I like to carry 2 with me at all times because sometimes they don't work and sometimes you need a second one. So having 2 is great. And then having a syringe, multiple syringes, just in case there's a manufacturer error, user error. I have had syringes not work before, so it is never a bad idea to have more than one syringe. And then alcohol wipes to clear off the area where you're going to be doing the injection site. This is like least priority out of all the priorities. Obviously we want a clean injection site, but it's most important to get the medication in during an emergency. So alcohol wipes, and then hopefully they'll have instructions, which we're going over now, but the National Adrenal Diseases Foundation offers complimentary instructions for you to keep with you at all times. So if someone were to find you unconscious, or if you were to be in an adrenal crisis and needing help but unable to assist yourself, you can give those instructions. So those are all the things that I keep in my kit. I also keep just extra hydrocortisone with me at all times. So first thing that we're going to do is there's a little circle at the top of the active vial. We're going to flick it off. I'm not going to actually do it because I don't have any spare right now. So we're going to go through the steps, but I won't physically be doing the withdrawal or the injection. So you flick off that little yellow circle, and then you manually, this is a physically challenging thing to do while in an adrenal crisis, which is why it's so helpful to educate other people. We're going to physically press these 2 together, and the purpose of this is you're trying to push that little rubber stopper into the mix with just the powder, and what that does is that opens up the space for the liquid to come through, so that way it can become a solution. So then we're going to roll the medication so that those 2 can properly mix together. And then once that is rolled, we can clean off the alcohol, use the alcohol wipe to clean off the spot. We're gonna inject in the upper thigh. So clearly imagine removing the pants and doing that. And then you're gonna get your syringe. So we'll get our syringe. Again, I'm not gonna fully do this. We're just gonna go through the steps. And now that that little yellow circle is gone, there's a rubber stopper in there, a little pinky peach thing. You're gonna stick the needle through that and then withdraw that medication, pull it all out, because that's 100 milligrams of solu-cortef that we need ASAP. And then you'll go ahead and inject into the upper thigh. If you have a longer needle, you might hit bone. It's okay, just pull out a little bit and then go ahead and inject all the medication. The next thing that you need to do is call 911 and get that individual or get yourself to the emergency room as soon as possible for follow-up care. Then there's a whole other set of protocols and things that you need to do once you are at the emergency room, either to advocate for yourself or advocate for that patient. But it's incredibly important information. I wish that we had a faster method. We are hopefully getting one in the future as it's being worked on. But in the meantime, this is life-saving information. So please share this with anyone and everyone that you can, especially those who know somebody with adrenal disease who carry an emergency injection kit. But now you know how to save someone's life or my life during an emergency, and that alone can help us feel more at ease, those of us with adrenal disease, knowing that those around us know the protocols and the steps in order to save our life. But as always, thanks for being here. Light, love, all the spoons, and I hope you have a wonderful day.